Health correspondent Nicola Hill live from London for us. Nicola, why is it that breast cancer is the leading form of cancer with all the advances and progress that has been made?
Yeah, you wouldn't think that would be the case, really, would you? I mean, if you consider that the first gene that causes breast cancer, the BRCA1 gene, was found in 1970. The BRCA2 gene was found in 25 years ago. And we know that a lot of women have undergone radical surgery, Angelina Jolie famously one of them, in the hopes of reducing their chances of getting breast cancer. But actually, genetic breast cancer only represents 2% of cancers. So why are so many women getting it? Well, there is a change in lifestyle. You've got people who are not eating properly, poor diet, obese, they're not exercising, smoking, drinking too much alcohol. But the main reason that more women are getting breast cancer is simply the fact that we're living longer. Dr. Julie Turode, who's from the UICC, which is the charity that set up World Cancer Day, says basically the longer you live, the more you're exposed to the hormones progesterone, estrogen and testosterone. And so that's why you're more likely to get a cancer. Breast cancer that peaks apparently between the ages of 50 and 60. So if you haven't died of an infectious disease, if you haven't died in childbirth and you're alive in your 50s and 60s, that's when you're more at risk. And the figures, certainly here in the UK, 1 in 4 women are at risk of getting breast cancer. So that's probably, the main reason why it's so common. It's not the biggest killer. It's lung cancer that's the biggest killer. But as you said, it's certainly now the leading form of cancer.
It's incredible, 1 in 4. Nicola, what can or should women do, especially in a pandemic, and especially if they're hesitant to go and get a screening?
Yeah, that's a really good point. I spoke to Professor Mary O'Brien, who's a breast cancer specialist here in London, and she is concerned that women aren't attending their mammograms. Now, many countries, certainly here in the UK, they offer a regular screening to women over the age of either 40 or 50 when the breast tissue is less dense and they're able to actually look clearly to see if there's any potential lumps. And it's really important to highlight that, if a lump is found when it's very small, an abnormality is found at the very beginning, breast cancer is curable. The figures are amazing. 98% of women who are diagnosed with what's known as stage 1 breast cancer are cured. They're still alive 5 years later. They call that a cure. So it's really important that any woman who either self-examines, and women are encouraged to do that, or attends a screening, to have a mammogram if they're offered it, because if it is picked up early, it is curable. Of course, the other thing, though, as you just said there, and in the report that you heard beforehand, because of the pandemic, so many women are either frightened of going for screenings or frightened of going to their doctor to say, I found something abnormal. They don't want to risk getting coronavirus, particularly if they are in their 50s or 60s, they're more vulnerable to the virus. And then there are also the problems in appointments being around. I mean, I have interviewed cancer survivors, cancer patients here in the UK who have said that their appointments and their surgeries have been delayed by months because of the hospitals being overwhelmed with coronavirus. So of course that is a problem. So the message that Professor O'Brien says, if you find an abnormality, do contact your doctor. That's all women globally. And it is important to realise that it's not just a disease in the high-income countries. Dr. Turode said, and the report from World Cancer Day and the WHO are all saying that it is becoming more prevalent in the low-income countries because of poor diet and because of people living longer, and because of fewer births. Apparently, you do lower the risk of getting breast cancer if you've had children, but only by a small amount. So it is important that screening is available to everybody. It's important that women self-examine, and it's important if they find anything that they report to their doctor.
Nicola, thank you so much for that and for those important points that you mentioned there and advice for women on such an important subject. Thank you, Nicola Hill.